Good afternoon. I'm Governor John Carney. I'm here with Dr. Karyl Rattay, the Director of Division of Public Health, and with A.J. Schall, the Director of the Delaware Emergency Management Agency. These two have been the point people on our response to COVID-19 over the last 2 months and beyond, doing a tremendous job along with their teams in emergency management and in public health. Just incredible work. Again, I'd like to thank our partners in addressing COVID-19, particularly through testing up and down our state. The state's hospitals have been the backbone of those testing efforts here in Newcastle County, Kent County, and in Sussex County. I'd like to particularly thank our partners in the community testing that's been done here in Newcastle County, in the Route 9 corridor, up in the northeast in the city of Wilmington, over on the west side with in cooperation with the LACC, and our efforts in Sussex County to test in the community in Georgetown, in Milford, and coming up in Seaford and at the poultry plants there. Really an incredible effort by all of our partners, particularly, again, our hospital partners, Bay Health in Milford, and BB Hospital with testing sites there in Georgetown area. Also, great help with LaRed, federally qualified health center there in Georgetown. Westside Community Health came down and helped us out as well. And I know Henrietta Johnson was a part of a community testing site there. And so public health and our team has been focusing on vulnerable communities and in this virus outbreak area in Sussex County. We have both good and bad news today, or cautious news, I should say. The good news is that the number of cases, positive cases, as a percentage of the testing we're doing is on a downward trend. That hospitalizations, I think, are probably the most important measure that we have because it's a real number. The hospitals count these individuals each day. They know whether they're critical care, whether they're in the ICU, whether they're on ventilators. It's just a very tangible number. It had peaked a little bit above 300, and now it's consistently, we'll show some graphs, below 300 and in the low 280s as of yesterday. And so the indicators that we're watching for 14-day trends are trending in a positive direction, which gives us some level of optimism that we will be able to start moving towards phase one of reopening later on in the month. Lots more work to do. But it also says, and we'll show the graphs in a minute, but it also says that our efforts to flatten the curve have been working, and that all the Delawareans who have pitched in, who've stayed at home, who've followed the guidance and the requirement to wear masks in public, to keep safe social distancing, went out in public, went in our state and county and city parks to do that in a way that's safe for themselves and their neighbors, not to gather with more than 10 people in one place. All those efforts, difficult ones, and to all the businesses that have been closed down, haven't been able to serve the public and greet customers, have made a tremendous sacrifice, and that sacrifice seems to be paying off. And so it's a very positive thing. It tells us that shortly we'll be able to move, take the foot off the brake, if you will, start turning on that dimmer switch to lighten up our economy. And at the same time, in some ways it's a bit of a mixed message to understand that the new normal includes following the direction to keep separate from one another, particularly when in public, to stay home to the extent possible. I was listening to the White House Task Force press conference the other day, or actually it was on our conference call with the governors, and Dr. Birx really offered a simple measure to communicate to the people of our states, and that is if we just reduce by half the number of times we go to the grocery store, the number of times that we go out to the drugstore, and the number of times we leave the house to do something in a public way that might put us in contact with other people or make it difficult to keep social distancing. If we do just half of those on a day-to-day basis, we'll be accomplishing the goal of reducing that multiplier below 1, which basically is to make sure that the virus doesn't continue to spread in our community, and that those cases as a percentage of testing will go down. And that's an important measure, the percentage of testing, because we're going to continue to do more testing. And in order to gradually reopen our economy, we're going to have to gradually scale up the number of tests that we're doing and the broadening out the community sites for testing. So we're making sure that we're getting into every community, and to do the surveillance testing so that we have some idea of the spread across the community. So my message today is we can't let up now. You know, we're getting to a good place. As Governor Cuomo said the other day, and I'll use the same expression, the people of Delaware have grabbed that curve and pulled it down. It didn't happen on its own. It happened because everybody pulled together. Everybody followed the restrictions, stayed at home, and we're seeing positive results as a result of that. But now is not time to let down. Now is time to lean in. And to go to run through the finish line, if you will, so that we can start to move to reopening the economy here in Delaware. I said earlier in the week, or I guess it was at the end of last week, the days all blend together for me, that the decisions that we have ahead of us now as we move into this next phase are going to be more difficult than the decisions we had in closing down our economy. And the reason for that is there was fear involved. There was the outspoken warnings of our public health experts, and there was the desire for, I think, all of us to protect our neighbors, ourselves, certainly our elderly parents, grandparents, and friends and neighbors. Now, we've got a situation where we still have COVID-19 that's present in our community. It's not going away, and we're not out of the woods till we have a vaccine or an effective treatment. But everyone's eager. They've seen and they're going to see that the number of cases and hospitalizations are flattening out and even trending down. And so they're eager to go back to work. They're eager to reopen their businesses. I listened. We have Zoom town hall meetings that the Lieutenant Governor Hall Long has been organizing and on a regular basis with the Delaware Prosperity Partnership for small businesses regionally. Our elected state representatives have been part of those Zoom calls. And so we've heard, and I've listened in, and I've heard the anguish in the small business owners' voices about just the economic carnage that has visited on them and their employees and their businesses in every corner of our state. And we're also doing, through Lieutenant Governor Hall Long, Zoom town hall meetings, which started this week, and I hear the same restlessness, the same eagerness to get back to a more normal way of life. And as I said last week, I don't make these decisions individually. We make them as a team with the science and data driven by and the expertise of our Division of Public Health, the advice and guidance that we get from the Centers for Disease Control, the White House Task Force. We did have Centers for Disease Control staff on the ground here in Delaware last week, both to provide advice and guidance on our testing protocol for community testing in Sussex County and for testing the workers at the poultry plant. They were also on the ground here consulting, the White House Task Force consulting on our testing plan going forward. And I think it's fair to say that they were very helpful in at least providing guidance, not so many answers when it comes to the actual equipment in terms of supplying the supplies that we need. And every state, I know every governor is working on that, and we continue to work on that. I'd like to thank the County Executive Meyer for his help and outreach that he's done to try to help us identify tests and the availability of tests, and of course the resources that he has been made available through the CARES Act. So I hear the anxiety out there. I try to talk to my mother every day. We were on a Zoom call last night wishing my young niece a happy birthday and singing happy birthday to her, and seeing my mother on the Zoom call, reminds me of the isolation that she feels. She's a very social person. She raised 9 children, lived in a big, small house with lots of people. I tell people all the time, I know how difficult it is to live in dense quarters and self-isolate. My father used to try to self-isolate us from time to time when we didn't follow the house rules. It's difficult to do, and one of the challenges that we face. But I see and I hear the anguish that my mother is experiencing, and I know all the citizens of our state are in the same place. And so together, we've been able to flatten this curve, and now we need to follow through, follow the instructions as we gradually reopen our economy. So let's start with the cases. Starting with statewide, we're well over 5,000, now 5,300, and sadly, again, up to 187 total deaths. Again, I can't emphasize enough our focus, and we'll hear more about it from Dr. Rattay, in protecting our nursing home population, our senior citizens, because that's where the vast majority of those deaths are occurring, the most vulnerable population. And as we move to reopen and allow people to circulate a little bit more than we've been doing, protecting that vulnerable population, our seniors, is going to be really important. Of course, 1,800 recoveries, and now here's an important measure I mentioned before: the current hospitalizations. Again, healthily below 300 at 284, and we'll see the trend, which is trending down in recent days. So how's it break out by county? Newcastle County trending just under 2,000 positive cases, and again, flattening out. Kent County is at 847 and fairly flat. And here's where, again, the spike is with 2,500 positive cases in Sussex County. If you factor in the population, lower population there, several times the infection rate up here in the largest, most populous county, Newcastle County. So I mentioned expanding community testing sites there in Georgetown, Milford, and Seaford. We did seek CDC assistance in doing that, and we've gotten their assistance, as I said a minute ago, on our testing plan. That's the second item there, where we will announce soon the framework for expanded community testing. We're working out some of the details there, supply chains and the like, working with our partners, extending the number of partners that we have, and focusing on more community outreach for those testing sites. And then importantly, the contact tracing effort that will have to go along with expanded testing to control the spread of the virus as it continues to be present here in our community as we reopen. And then lastly, sheltering in place for those who are identified as COVID-19 positive to reduce the contact and the spread. So we still have 25 cases that don't have a county identification. And then next is the demographics. Again, we continue to do a good job, and I think there is something inherent in the virus that makes younger people more resilient because of the numbers there still remain very small compared to the rest. And so the next is what we're starting to call our dashboard. You know, as it became clear that we couldn't use just the one measure of declining cases on a day-to-day basis because we would be doing more testing, we decided to look at a series of indicators with a 14-day view, which is what the White House Task Force and the CDC is recommending, and focus instead of the day-to-day number of new positive cases, but the percentage of people who are tested positive. So you have a measure that takes into account that you're testing more people, and including a 5-day average there to even out the fact that there's an unevenness in the days that the hospitals are testing, and an unevenness in the days that they get results back. And so you can see the current hospitalizations remain a little flat with a little bit of a peak there around April 27th. New hospitalizations, importantly, even though the cases in Sussex County, the number of tests we're doing in Sussex County are so much more, and you can see that this too is a little bit uneven, but the trend is certainly down. And over the last several days, each of the hospitals in Sussex County and Lower Delaware have reported lower census in their emergency room and among COVID-19 positive patients. So I mentioned a percentage of people who test positive. That's a 5-day average, so that helps to smooth out some of the ups and downs and shows a declining trend. New positive cases, again, 5-day average, it would be much more uneven if you did it day to day. You can see the little blip up there around April 24th, the week of April the 24th. And then, of course, the cumulative number of positive cases obviously will continue to go up, move up. It is moving up more slowly. If you look in the last graph, you can see the increase there since the beginning of the first case back in February and March. So going back to our messages that have guided us, we need a healthy community. Before that we can have a healthy economy, we need to have both. They can't be mutually exclusive. And as we think to have a reopening of our economy here in Delaware, we're reaching out to various sectors to determine how businesses can open, whether it's retail, whether it's restaurants, whether it's bars. A lot of focus now on the hospitality and tourism industry as we approach the Memorial Day weekend. So we're looking at ways to increase economic activity in our state. We're announcing today some accommodations, some baby steps, if you will, to certain retail establishments to allow them to operate on a limited basis. And a lot of this comes from feedback that we've gotten from the various sector work groups. And so those will begin Friday. We've been making them public today. For review, an idea of the list of businesses that can take those interim steps, you can get that list from de.gov/economy. And so our objectives here for this interim set of steps is to safely provide some revenue and economic relief to Delaware businesses and workers, to maintain strict adherence to health and safety guidelines, which are important as we continue to self-distance and follow the guidance around hygiene and operating safely. And again, to use the measure that Dr. Birx mentioned on our White House call the other day, is if everybody could think about just reducing the number of times they go into the public to do an essential businesses, activity, to the grocery store, to the pharmacy, to fill up the car, just try to do half of what you would normally do and to stay at home other than that. And so we're preparing for phase one. This remains a serious situation, particularly there in Sussex County, where got all hands on deck down there. And again, I want to thank all our partners for their efforts to help us with testing, with education and guidance to community residents there, to helping isolate COVID-19 positive citizens in the hotel that we've stood up down there for that purpose. All our community partners, we thank you. Things are going to be different. I think that's the measure, is the message as well, as we in a rolling way kind of reopen business here in our state. We need to do so, making sure people still stay 6 feet apart. The virus will still be present. We feel like we're getting control of the virus by social distancing and stay-at-home orders, and we would encourage people to do that, to wear masks, and to follow the rules. So strict social distancing guidelines, face coverings for employees and patrons, and again, no large gatherings. So the message this afternoon is some positive news and some words of caution. The positive is that our efforts to flatten the curve are working, that the indicators are flattening out, and in some cases moving down in a positive direction. But we need to stay the course and really lean into to those activities, those practices that have enabled this to happen. And we need to pull that curve down even more. And as we reopen businesses, not to forget about your mask wearing, your social distancing, helping business owners and establishments as they gradually move to retail operations that are done over the internet with curbside delivery and different ways that we can accomplish our objectives to keep people separate. So with that, I turn it over to Dr. Rattay to talk about some of the things we're doing to really lean into helping the most vulnerable population, our long-term care facilities and our senior citizens.
Great. Thank you so much, Governor. I wanted to start by recognizing that it's Nurses Week. And I think all of us are in awe and with great and deep appreciation for what our nurses do as the backbone of our health system. The heroic efforts made by so many in the nursing field to respond to this crisis, whether it's caring for COVID patients or being a part of the testing sites. We have a number of amazing public health nurses who have done just a tremendous amount of work. So thank you to all the nurses out there, and happy Nurses Week to you. I hope you all get a little bit of rest this week. So long-term care facilities, as you all know, is an area where we have been extremely concerned, and we have implemented a number of measures to help, whether it's to screen or identify or test individuals in long-term care, residents and staff, as well as to help support the appropriate use of personal protective equipment in long-term care. What has become clear is that since there is asymptomatic spread that is so common, it makes it more challenging to really identify and isolate individuals who may be spreading the infection. And so for that reason, we are supporting universal testing across our long-term care facilities. The plan is to test all residents and staff who are in our long-term care facilities for COVID-19. DPH will be providing the facilities with tests and testing supplies and training and support for this program. to help us, again, protect our most vulnerable Delawareans. The reason this is so important is if we do better understand whether it's staff or residents who may be infected, whether it's pre-symptomatic, so before they develop symptoms, or asymptomatic, those without symptoms, we can better support staffing, staffing training, and really isolating individual staff and residents to help better prevent spread. So we are really grateful to our partnership with our long-term care facilities and their medical directors, and are looking forward to supporting them in this way. I also wanted to mention that we've had a team, a DMAT team. It's a federal asset. DMAT stands for Disaster Management Assistance Team. We asked for this asset to help support us in our support of long-term care facilities. We've had this team here working with us for a little over a week now, and it's actually 10 nurses. So again, thanks nurses. 10 nurses who are helping us to go out to long-term care facilities to really train them on PPE, make sure that they are using it well. Now they'll be helping with the testing, but also they help these facilities understand what to do with positive tests and kind of how to safely isolate people. So we're really, really grateful for this asset. These folks, not only are they 10 amazing nurses, but they are from the Delaware VA hospital in Wilmington. And so, again, just so grateful to have their support with these efforts. I'll also mention before we go off of this that this testing guidance is also consistent with new CDC guidance that came out just on Sunday to prioritize testing of residents in these facilities. Also on the testing front, we now in our DPH lab have tested 3,176 individuals. But an exciting number is the hospital testing program has now led to over 30,000 tests across the state. And just in the last week in Sussex, with the testing sites stood up by Bay Health and BB, and now Nanticoke has their first one today, and the partners that Governor Carney mentioned, over 4,000 tests were administered in Sussex County over the past week, and so we're really incredibly grateful to our all of our partners in Sussex who have helped this to make this happen. I mean, not only has the testing occurred, but after the testing, the assessment of, can a person safely isolate, and do they have what they need to protect themselves and their family members from the spread of infection, the education that they've been receiving, we all know is really, really important to help push down the infection rates that we have been seeing in Sussex County. So with that, I will hand it back to Governor Carney.
Thank you very much, and Dr. Rattay, again, special thanks. I know your team has been working overtime this week, working with our testing partners to both do the community outreach testing sites here in Newcastle County in the city of Wilmington, as well as the really excellent effort there in Sussex County, in Milford and Georgetown, the Sussex side and Kent County side of Milford with Bay Health, BB, and now Nanticoke today. A really coordinated effort. The local law enforcement talked to the mayors down there as well, and more importantly, getting education and guidance to community members that come to get tested in the community sites, the care support packages, kits with hand sanitizer and bandanas for masks and other cleaning material, and I think thermometers too were in some of those kits, and some advice too about making sure the folks get tested. We did have a few drive-up sites as well as the walk-up site in the community, which I think was really very effective and a good way to, and of course a special thank you and shout out to the nurses out there doing a tremendous job with us every single day. AJ?
Thank you, sir. I have a few things to go over today, but first just want to go back to the hospitalizations numbers the governor is talking about. So while we've seen some stability in the hospitalizations and a slight decline in new admittance, we also have heard from our EMS partners and the hospitals that their emergency department volume is going up a little bit. So we have to make sure when we look at these phased approaches, we look at the health of the whole pre-hospital and hospital system. So just something we're going to keep an eye on over the coming weeks as well.
Is there any sense, AJ, that some of that is a greater comfort level for people coming back into the hospitals, or you haven't got that kind of
I think
feedback
we've heard a lot of people have delayed going to the hospitals for stuff because they've been abiding by the shelter or stay-at-home orders. However, I think definitely probably seeing a little uptick in the traffic on the road as well. So probably a combination of both. But we'll be watching that as we go through this reopening process. Talking about that, part of what we've heard from the town halls that the Lieutenant Governor's put on and Department of State's been a great partner with is how can we assist businesses as they begin to reopen. A question and a concern that I think has come up on almost every town hall is, I'm a business owner, I need to supply, I don't have access to whether it's a face coverings, food grade, gloves, cleaning solutions, stuff like that. So we have developed a recovery interchange portal that is for businesses to go directly business to business with. We've received a lot of offers from vendors to assist over the COVID crisis, and we've captured all that information, so we want to make sure we publicly prepare that information so businesses could tap into that as well. So this is really an undertaking that's going to be worked on this week. It will launch next week. Big thanks to our Department of Technology and Infrastructure, Department of State, partners over at GSS, Office of Management and Budget, to really pull this together. So this is going to expand on the community call to action that was launched on the DHSS website approximately 4 or 5 weeks ago. Companies will be able to enter information how they're able to sell or provide a service to businesses reopening, or businesses could go there to kind of self-serve themselves to find out who they could go to for items. So again, this is going to be providing information. Businesses will link up with each other, and again, it's hopefully one thing that makes the reopening process a little bit easier. And then finally, as well as it's Nurses Week, I know it is also a Hurricane Preparedness Week. Well aware that the Mid-Atlantic is a late, mid to late hurricane season state with the impacts of it, but I think if anything that we have learned as a society and a state and a country is that we can never under-prepare for anything. So I'm asking everybody this week to make sure you understand your risk when it comes to not just hurricanes, but tropical storms, flooding events, and some of the other severe weather we've seen in the last few weeks. Prepare supplies, make sure you have access to whether it's prescription drugs, dog food, food and water in the house to sustain people for several days. Check up with your insurance. If you have some time right now, log in, check out your insurance policies, see if there's anything you could do to better prepare yourself for if a natural disaster strikes. And then what we've really been pushing the last few years is make sure you plan for your pets as well. A lot of people have a plan of what they're going to do, where they're going to relocate to, and they'll forget their domestic animals as well. So if you're at home, you have some extra time, visit preparede.org for more information on hurricane preparedness and other good tips. So a little shameless shout out there just to get people thinking about the summer months coming ahead. Governor?
Oh, for a hurricane. Goodness gracious. Well, I just want to thank all the frontline workers out there. We've got asking business operations and towns and municipalities and everybody to show your thanks by lighting it up blue for frontline workers. It's our way to just say thank you to everybody who's been on the front lines. And lastly, again, we're all in this together. Not exactly last. We want to have a commercial put in here for reminding people to return your census forms there. Visit my2020census.gov or call the number, which I wish I could see from here, but I can't. It looks like 844-330-2020. I got it right. Again, I don't need a new pair of glasses. But we need folks to return their census forms so that we get an accurate count here in Delaware. I know the Lieutenant Governor has a big coalition of folks working on that, and we appreciate all the community workers reaching out to make sure that we get everybody counted in our state. And then lastly, again, we're on this together. We've grabbed that curve and pulled it down. All our efforts over the last 2 months are bearing fruit. We're seeing a flattening in the curve. We're not out of it yet, and we still need people to stay at home, to limit the times they go out to public, to wear face coverings and masks when they do that, to make sure you're washing your hands and protecting your neighbors, and in doing so save lives. And in particular, look after your elderly neighbors and parents and grandparents, because those are the folks who are most vulnerable. Those are the ones that have been dying in our state and now closing in on 200 deaths. This is no time to let up. This is really a time to lean in. And if we do lean in and we stick to it, we'll get to where we need to be. It's not going to be the old normal when we start to return. It's going to be a new normal that requires social distancing. It requires these hygiene practices until there's a vaccine and effective treatment for COVID-19. So with that, again, thanks to the media for coming and for your reporting. We appreciate what you enable us to do in getting good, solid information out to the public and the stories that you report on the ground here in the state of Delaware. So we'll open the floor to questions. I know most of them were submitted online, but I see Esteban here. Why don't you lead the way since you are here in person?
So yes, Esteban Parra with the News Journal. This question is about the reopening of some of the businesses. Does this administration have an estimate on how many workers this move will allow to return to work? Also, will workers who can return to work under this move still be eligible to collect unemployment benefits, if they fear for their health returning to work and want to stay home?
Yeah, I don't have an answer to either question. I do know that these are mostly retail business establishments and businesses that have been closed that in some ways look like larger businesses that have been open because they sell food and therefore were determined to be essential businesses. I wouldn't hazard a guess with respect to how many. I would think it's thousands of Delawareans, and I do not know the effect on their returning to work on their benefits in terms of unemployment and the like. But we can certainly get you that answer from the Secretary of Labor.
Okay. And the other one is Ocean City said they're going to open their beaches. What's Delaware looking at?
Yeah, that's probably the toughest decision that we have coming up, and I had hoped to kind of coordinate that with Governor Hogan, and we have been calling his office. I think local officials down there we were not coordinating with, obviously, but I did get a letter today from the Association of Coastal Towns in Delaware. Very thoughtful letter in terms of how they see it. One of the things they mentioned in there was that each of their towns are different. Say Rehoboth and Bethany in particular are different than Dewey Beach and Lewis and some of the others. We had a call with the mayors today, earlier today, and a lot of the beach issues came up. Fenwick Island in particular was wondering, how am I going to keep people who are going on the beach in Maryland from coming over the state line to his beach in Delaware? If folks need to remember, we didn't have a complete shutdown from the executive order, so you were able to go out on the beach as long as you're walking, you're keeping social distancing, and there were accommodations for surf fishing just for individuals. I'm not sure that went very well, by the way. And so I'm not sure that over in Maryland, they're going a little bit further than we are, I think, and we're going to meet. We're going to have a conference call later this week to talk to the mayors and see if we can come up with a consistent plan. In terms of opening the beach more broadly, I think looking towards the end of the month would be kind of the best estimate of when that might occur. And that consistent with what I saw in the mayor's letter today. But we'll be making that determination. Meet with the mayors, get their input, make some differentiation among towns, and then decide how to move forward. Thanks, Esteban.
Tom Lehman at WBOC says, the mayors of Delaware beach towns have sent you a letter about reopening. What's your response to them and to business owners that are antsy to open up again? And additionally, do you have more concerns about Ocean City's decision to open their businesses and if that will in turn affect Delaware?
Yeah, starting with the last question first, I do have some concerns there with Ocean City opening their businesses. Obviously, businesses on this side of the line are going to say, why not us? I did get a thoughtful letter, as I mentioned, to Esteban from the town mayors. They've really thought it through. They've talked among one another about the differences in each of their jurisdictions and have different considerations for us there. We want to make a smart decision. We understand that the weather's getting nicer. People want to be at their beach homes. Obviously, if you live in Delaware and have a beach house, you obviously have the right to go, and there's no restriction for you going there. And you can be on the beach as long as you're not just sitting, laying, or in big groups on the beach if you're walking or running or that type of activity. So we'll have to take a look at that and what do you do there with Fenwick Island, which is right up against the Maryland line, and it's probably not clear to most folks where the line is when they're out there on the beach, and have to keep all those considerations in mind. The biggest concern is the large gatherings, right? And people being close together. And Dr. Rattay might want to comment on that. I mean, as we move towards reopening, particularly rolling reopening, part of what will allow us to roll to the next set of businesses will be how effectively can they avoid that social interaction? How effectively can they, as businesses, social distance? Even now, if you go to the establishments that are open, they can only have so many people in the store at any given time. I was out at one of the big box stores over the weekend, had to wait in line for about a half hour because there was somebody there with a counter making sure only so many people were in there. Even with that, it's a little bit difficult to keep your distance. The aisles tend to be one way down, one way back. And so those are the kinds of accommodations that our business sector advisors and individual small businesses, and that's why we've been doing these Zoom business calls to determine what those considerations, what those business arrangements, business establishments might be. Dr. Rattay, just on the need to social distance and the concern from a public health perspective.
Yeah, I mean, social distancing works. That's why we're doing it. And at a time when there is no vaccine and no treatment, social distancing is by far one of our most effective tools. And the way this virus works is it spreads from person to person through droplets. So staying 6 feet or more apart from one another, and now, as we know, asymptomatic spread being so common, wearing a face covering, and of course still staying home if you're sick, and all the normal stuff, washing your hands, remains so incredibly important. As everyone's starting to think about the next phases, preparing to really wholeheartedly support social distancing in every setting is going to be critical for us to move into phases of reopening.
Yeah, and it's important to really emphasize that point, right? Everybody's eager to get back to business. Everybody's eager to get back to the way things were. We're not going to go back to the way things were completely, but our ability to follow the social distancing, rules will enable us to open up more. We'll continue to push this curve down and make sure that the the percentage of positive cases continues to go down, because we have to, one of the requirements of moving forward is to do more testing. And so we're going to do more testing, and so it's likely we're going to find more positive cases, but the percentage of those positive cases needs to be on the decline as it appears to be, and that's going to be an important measure as we move forward.
The next question is from the Delaware Public Media. Given the increased testing that has happened over the past week in Sussex County, specifically centered around the poultry industry, will the state release numbers of cases or deaths associated with specific processing plants?
Yeah, I know that I don't have, and I don't think we have specific numbers for the processing plants. You know, we did one abbreviated testing operation at the plant in Milford, and I've not seen the specific results for that plant. And then this week, we're in the midst of finishing that plant and we did another plant there in Harbison. And I'm not aware that we get that, nor are we, do we have the legal authority to release those data. They do obviously come out mixed in with the Sussex County and Kent County information depending on where the worker lives.
Yeah, I'll add to that. One of the benefits of having the CDC team here on the ground is they've sent some epidemiologists, and they are helping us to, as best as possible, look at and understand the data, both in the poultry plants as well as in the community, and to understand, are we seeing improvements in the spread and decreases in positive cases, which is obviously so important.
We're hearing a lot about contact tracing now. It's kind of one of the key phrases that we're hearing. Amy Cherry at WDEL asks, in terms of contact tracing, what is the definition of close contact? Is it hugging, sharing computers, sitting in the same smaller room, using the same entryways? What are some examples of that?
Yeah, that's a great question, and it goes along with what we were just talking about with social distancing, right? This virus, when you sneeze, it can go a little further. When you cough, it can go a little further. When you speak, less so, 1 to 2 feet, but nonetheless, that's how the virus leaves one person to go to another. And so when we're doing contact tracing, when we know we have a positive case, we ask them a lot of questions, and that's part of case investigation. And one of the questions is, how many people or who were you in close direct contact with while you had symptoms or within the previous several days? And so that means people that you were less than 6 feet away from, and in general, that's 10 minutes or more. So it's not, who did you pass by in the supermarket, although we really want to prevent, any of those kinds of spread of infection, but direct contact is usually, that more sustained period of time, 10 minutes or more at 6 feet or less. And those are the people then that we will follow up with and have them be quarantined and also testing as appropriate.
The next question's from the Delaware Business Times. They said, with the increase in hospitalizations we're seeing, what are we seeing in terms of hospitalizations in Sussex County over the past week on the heels of the big jump in positive cases?
Yes, so we actually have seen a decline in new hospitalizations statewide. I don't know if we have the graph, whether we're able to go up or we're able to bring on. We've got a nice dashboard that I would recommend people visit on the de.gov/coronavirus website under My Healthy Community. Lots of really good data, and I've seen letters, and I've heard people talk about the need to see these graphs, and we're making them available so folks can see what we're referring to. I've called a little bit of an audible here on our tech team, and understand we're working on it. I'm looking at the dashboard here in front of me, And one is new hospitalizations by day, and then one is current hospitalizations. Current hospitalizations means the census in any given day, the total of any given day in all of the hospitals in our state that are COVID-19 positive. And then the new hospitalizations would be those that were added, on a day-to-day basis. And you can see it's a little bit uneven on the new hospitalizations, but it's trending down, which, given the fact that we're over-testing, we've got an outbreak in Sussex County, the fact that that's down, trending down, is a pretty positive sign. We don't know yet whether it constitutes a trend, but it certainly says something about the severity, the acuity of the illness among the population that's spiking up in terms of the number of positives. So again, that becomes a very real and important indicator as we move towards thinking about reopening, as we think about a comfort level. One of the criteria is that you have to have comfort in your surge capacity in your hospitals. It's part of the CDC White House phased-in approach, Reopening America document. And so you see it here, pretty flat on current hospitalizations, and clearly a downward trend on the day-to-day. Now this is just a 14-day trend, which of course is what the recommendation was to look at. If you back it all the way up to the beginning, you're going to see quite a climb and then a falling off there. So I would recommend to folks to come to look at this data. There's data in there by county, by race and ethnicity. We don't have all of that data as we've reported, but we have now required that it be reported. And so we get a better picture of the demographics of those who test positive, the demographics of those who are tested, and all the rest. And so there you see, if you back up, you can see, here's our, this is a measure of flu-like symptoms as reported in emergency rooms going all the way back to beginning of the year, I believe. You can see how they trend upwards. And what you don't see on that graph is that it starts to fall off on the other side. And then the cumulative cases obviously will continue to rise, but gradually you can see the slope is flattening out just a little bit. And then the next set of bar graphs is really just the red light, yellow light, green light in terms of PPE that you need to have available. And AJ's doing a great job, and his team and the team at Public Health and DEMA in monitoring that and doing the equipment sourcing and the rest. So I'd recommend to everybody who's interested in the detail to go to de.gov/coronavirus and the My Community Health. Click onto My Community Health and you see all the data there. You can also see the intensity, the so-called heat map that shows the hotspots in our state.
Sean Green at WDEL says, you said last week you need a metric that combines science and economy to determine getting to phase one. What specific economic statistics are you focusing on as you try to make that determination?
Yeah, so what I meant is the need to balance off these data that we're talking about and these criteria that is a measure collectively of the health of the community, of the spread of the virus, of the presence of the virus in the community, and have we reached that inflection point where its spread is declining as opposed to expanding, right, importantly. Mm-hmm. And so we seem to be approaching that place. I know what the economic indicator is, the carnage that I hear on the Zoom business calls geographically. Individual business owners talking about what's happening to their businesses, workers who need to and want to go back to work. I hear it every single day. That's not a statistical measure, although you can look at the unemployment number, which is just off the charts. You can look at our own budget numbers and revenue declines talked to the county executive, the mayor of the city of Wilmington, our mayors. They're seeing all of that. Just the overall carnage in the economy that you have to balance off with where you are with these statistics that we're seeing today. And as I said, it's good news, but the caution is working together. We help create the good news by pushing that curve down, flattening out the curve. And now we need to keep leaning into that so that we can move through the phases of reopening.
The Delaware Public Media says, can you give an update on the state's efforts to support homeless shelters and housing insecure Delawareans? How many cases have been reported among Delaware's homeless population, if we have those statistics, and how many at-risk people have been relocated from shelters or other situations into hotels?
Yeah, I do have some numbers because I did get this question. I did see it in advance. And first of all, to the Lieutenant Governor and to Dr. Gibney and to Rita Landgraf and to all the folks over at Division of Health and Social Services who've really done an amazing job with this. Overall, they've reported that and Megan Wallace, who works with all those community partners, they've screened almost 2,400 homeless or presumed homeless, housing insecure Delawareans. They've housed 709, and I understand that 230 or thereabouts are individuals that have a mental illness, as well as having permanent housing difficulty. I know that we have hotels where they've encouraged these individuals to go. And as a way of, frankly, keeping them off the street. It does create some issues with respect to social distancing again, and I know one of the hotels is right near my house, so I can see that firsthand.
Another question from the Delaware Public Media. What is being done to support undocumented immigrants specifically? Is the state working on making financial assistance available to non-citizens? And what are they doing to get the message out to non-citizens that it's safe to seek testing?
Yeah, so I get this question a lot, and I get this question with respect to others that didn't qualify for various aspects of the federal relief, and in particular, the undocumented were not eligible for some of that federal relief. But we don't, as a state, we don't have a program for anyone, undocumented or not. In that respect, we do have a program for small business owners, but we don't have a direct, other than unemployment, which people are eligible for as long as they have a work number to qualify for both federal and state unemployment. So we don't have a direct public assistance check, if you will, to folks, to undocumented or otherwise.
Are you this is from Jim O'Donnell at NBC 10, are you considering granting long-term care facilities immunity from civil litigation during COVID-19? This is something we've been seeing in the news recently as discussions. Why or why not?
Yeah, so there's been some discussion about that. I know Public Health has a view. I don't think there's been a legal determination. I think we've made more progress with that issue with respect to hospitals, but I don't believe it's going any further than that.
The last question's from Tom Lehman at WBOC. He says, what's the status of Delaware's unemployment trust fund? Many states are seen running out of money. How much does Delaware have? And do we have any idea how many more weeks the state could continue to pay out under the current circumstances?
Yeah, I don't know the exact number there. I know it's been pretty exhausted. Generally, when the fund is empty, we borrow from the federal government, and I expect that will be the case here. The bigger question is, can we use some of the CARES Act funding to replenish the unemployment insurance fund And that's relevant because, and there's been some indication, I've talked to Senator Coons about it, I know he's been talking to the U.S. Treasury Deputy Secretary there, and one of the reasons that you would want to do that, if you didn't replenish the fund in some way, then all the businesses and small businesses would have to pay a much higher tax to replenish the money at a time when they don't have revenue to do that, and so it'd be counterproductive. So being able to use those federal resources to replenish the fund would be a very positive thing.
Just an update from Secretary of Labor released this morning. It has been $140 million paid out over the last 6 weeks.
So it sounds like we probably still have money in the fund, but that's a lot of money that's gone out the door.
Is that a reason why we're reopening businesses, following up on his question?
No, not that we're running out of money in the unemployment fund, no. The general desire for people to go back to business, to go back to work, the need economically to do that to keep our economy strong. The longer this goes on, the carnage is in terms of health and welfare, the ability of people to pay their bills, the ability of business owners to stay open. Any business that fails takes employees and workers down with them. The impact it has on folks that have to, particularly elderly folks that don't get an opportunity to get outside of their homes. There's just all kinds of economic and community carnage that's visited upon the state of Delaware and every corner of our state. But having an economy that generates revenue to pay employees so that they can support their families is a very, very important part of that. Okay, Esteban, thank you for coming, and thank all the questions that we got online. Appreciate, again, the opportunity to update everybody in our state to the situation here and our response to COVID-19. Good news today in that we are seeing a flattening of the criteria that we're using to trigger the reopening of our economy here in Delaware. That will be a rolling reopening. We announced today some interim measures to allow certain retail establishments and others to start to gradually go back online, to reopen in a way that's safe. We still need to stay at home and wear face coverings and observe social distancing. All those activities have helped us to get where we are today, where we're seeing these positive trends. But don't misunderstand any of this or misinterpret any of this to mean that we can take our foot completely off the brake here, and that we don't have to be careful when we go outside, that we don't have to limit our social gathering, and we don't have to continue to stay at home, to not gather with more than 10 people, and to wear your face mask. But gradually, if we stick to this and we have these interim measures to open the economy and gradually work with business establishments and nonprofit sector and all our testing and public health things that we're doing, we will be able to gradually move back. We have some very difficult decisions and a lot of hard work to do. Some of the criteria that are necessary to move to a greater reopening than what we're talking about today is to be able to test more extensively than we are currently, to protect vulnerable populations, and Dr. Rattay announced an initiative to really lean into that with our nursing homes and testing all of the residents of those nursing homes to protect those populations, because that's what we have to do as we allow people to circulate again more socially to protect the spread, particularly from those senior citizens. So testing, isolating those positive, social contacts, protecting vulnerable populations, and really being conscious of the fact that we still need to protect one another. And we're in this together. We've pulled that curve down together across our state. We're addressing the hot spots, and we need to stick together as we start to opening up the economy of Delaware in a gradual and responsible way, and have a healthier community as our economy gets healthier as well. So thank you, everyone. We look forward to the next time.